what I try to talk about when I make a presentation is homeopathy in particular, but in general I also try to put it into context, which I find most people don't have. Even people in the field for years don't have a real context. They think about natural modality as this thing, I do this thing, and medical doctors do that thing, and they're different because I do something natural, whatever that means, I'm not sure, but it's better. That's one of the things I hear kind of from people. But there's not a real context of what is different about allopathic medicine. Everyone knows the term allopathic medicine by now? No? Yes? I can't hear the... No, okay. Allopathic medicine is the term that was coined a couple hundred years ago to describe conventional medicine. So allopathic medicine refers to a type of practice, a philosophical orientation. We might use the word conventional medicine to refer to, you know, what you're used to, the medical doctors and so forth. But that refers more to institutions, organizations, establishment medicine, the hospital system and all that. It doesn't really say much about the orientation of the practitioners. Allopathic medicine refers to the orientation, the philosophical basis of practice. If you talk to an allopathic doctor, and we all grew up in our culture here, so you're all very familiar with that approach, but you may not actually know what it is in a definable sort of way. You know, it's drugs and surgery and lots of technical medicine and so forth. But there's actually a philosophical basis to that practice. There is a perspective on health and disease that is distinctive to allopathic medicine. That distinctive perspective is one that the people within the system barely recognize. If you talk to a medical doctor about your philosophy of medicine, they'll say, I practice scientific medicine. Scientific medicine, with quotes around that, refers to their belief that everything they do is based on science and therefore it's the thing to do, without recognizing the philosophical underpinnings or the political, social, economic forces that create the very thing that they're doing. So it's sort of lived through without being aware of it, much like a fish is not aware of water. You're in it all the time, so why would you think of anything else? And that's kind of how it is. But as an alternative practitioner, I come from the outside. Of course, I came literally from the inside, since we all grew up with allopathic medicine, and I went through a process of relearning, learning about alternative medicine, and then turning around and looking at allopathic medicine and learning about that in a philosophical way. You don't generally, from within allopathic medicine, get it until you kind of step out of it, and then you have something to contrast it to. It's very much like people who say, you know, without evil you don't know what good is. Without good you don't know what evil is. So it's that kind of thing. Not that allopathic medicine is evil. That could come off the wrong way. But that idea of contrast is how you learn how things are. So what are those contrasts? Basically, alternative medicine can be divided into several different categories. But the first definition of alternative medicine would be medicine that is not utilized by conventional medicine. It's an alternative to conventional medicine. Now, there's a new term, new to me, new in the sense that since I've been practicing, that came into popular use, which is complementary medicine. When I first graduated in a long time ago, over 20 years ago now, when I first graduated, complementary medicine, that term didn't exist. There was alternative medicine, which was synonymous with quackery, and there was conventional medicine, which was synonymous with all that's good and right and scientific and approved, and everything else is if we didn't learn about it in medical school, it couldn't possibly be useful. And therefore, if it's not useful, you must be a quack. So that was the environment that I graduated with. So complementary medicine came into existence when a shift began in the 90s, the early 90s. There was a shift where research started showing, people finally actually started doing research on alternative medicine, and they discovered, to their shock, that something like 30 to 40% of the population was utilizing it. And they never told their medical doctors, their allopathic doctors, their conventional doctors, whatever you want to call them. By not telling them, they were living, this whole process was going on underneath the noses of conventional medicine, and they had no idea. But the big shocker at this point in time, this is 93, the big shocker with this article that was published in the New England Journal of Medicine, it's the Eisenberg study on alternative and complementary medicine, or whatever they called it, was that there was more money being spent on alternative medicine every year than there was in all of primary care. And that, I like to say there's before Eisenberg and after Eisenberg, BE and AE, because everything changed since then. And you were probably all a product of that change. This massage school is probably a product of that change. That change was the big shift where conventional medicine suddenly realized it wasn't alone, and it had to deal with alternative medicine. It couldn't dismiss it anymore as just quackery and the only thing that charlatans and stupid people did, because everybody was doing it but them, and everyone knew they were doing it but them kind of feeling. So research started being done. The first efforts of the research was to discredit it and say, well, okay, if we actually study this, and we'll be able to show to everybody that it doesn't work, and we can all go back to normal, back to the good old days when medical doctors were king and God and queen and everything all wrapped into one. Unfortunately from them, their point of view, fortunately for us, when they studied alternative medicine, they found out that a lot of it did work. And voila, here you are. So there became an acceptance of alternative medicine and this new term, complementary medicine, that didn't exist prior to this study. And this acceptance led to massage being available because massage was always alternative, in case you didn't know that, until very recently, available in hospitals, and acupuncture now be available at the med center. These are huge changes that 20 years ago people might have imagined would happen someday, but someday means like, on my deathbed it'll be happening. Instead, it's accelerated very rapidly. So the difference between alternative and complementary medicines, worth understanding. Complementary basically says that I'm doing a therapy that is going to complement something else, usually conventional medicine, but complementary medicine might be utilized to complement what I do in an alternative form. Alternative medicine, on the other hand, would be where you're doing something that truly displaces or replaces a conventional therapy. So a chiropractor would be an alternative practitioner in many cases because they're going to displace the orthopedic surgeon by doing adjustments. An acupuncture would be alternative because they're going to displace somebody giving pain medication, perhaps, or some other treatment that they would be doing with Chinese medicine that would displace some other conventional treatment. A lot of massage therapy would be complementary, but some of it's going to be alternative as well. And as you go through your careers, you'll be able to recognize one from the other, because one is where they stop taking medications or stop going to their medical doctor because they don't need to anymore. And the other is you're helping them feel better while they're continuing with whatever treatment they've been receiving for their health problems. And within the conventional, there's another division. Let's look at that one. Alternative medicine and natural medicine, and complementary and alternative and natural medicine are not synonymous either. So natural medicine refers more to, at least the way I define it, more to a philosophical orientation that has to do with the way and reason that you do what you do. Alternative just means, as I said before, it's not part of the conventional system, and it displaces certain aspects of it. But within alternative medicine, there's some very allopathic approaches that are being used. Approaches that would be very comfortable within conventional medicine because of their orientation, but are not currently being used. At one time, for example, alternative medicine included radiation therapy. In the 30s and 40s, it was considered quackery to do radiation therapy. Now, of course, it's a common treatment for cancer and so forth. It's incorporated into the conventional system because it fits with the conventional system. Now, the philosophical basis is the same. Natural medicine has a different philosophical basis. So within alternative medicine, you have natural medicine and you have allopathic medicine. The allopathic meaning the orientation is different than even though it's not accepted by conventional medicine, it's different than the natural medical orientation. So let's look at what that is. If you are someone who is oriented towards practicing allopathically, you will see disease in a particular way. Disease will express itself as symptoms. You will want to do something to make those symptoms go away. A natural medical orientation will see those symptoms rather than expression of the disease, which is the allopathic model. You'll see those symptoms as an expression of the organism's reaction to the disease. Now, this is a fundamental concept that is the difference between night and day. So if you don't get this one, you'll never understand what I'm talking about. We see every living organism as constantly in the process of maintaining balance. In physiology, it's called homeostasis. The homeostatic process is one that's ongoing in every living organism, whether it's an amoeba, a tree, a one-celled animal, or a plant, or a human being. Every living organism can be defined as living because of this process. You could define life in this very narrow way of saying life is when something is maintaining its own balance through these biochemical processes and stuff that goes on. And then there's one point in the life cycle where that process, where homeostasis is no longer attempting to be maintained. And what point would that be? Death, exactly. So you could define death as the point where homeostatic mechanism is no longer functioning. So in conventional medicine, everybody understands that. Physiology talks about homeostasis constantly when you're studying it as a basic science. But when you enter clinical science, a shift takes place. That shift says, okay, physiology is good. We understand that. It helps us understand pathology and so forth. Homeostasis is a wonderful thing. But now we have a sick person, and we have to look at that differently, because this sick person has something wrong with them, and we need to fix that. Our view is it's the opposite. When someone comes to us and they're sick, what we're seeing is a living organism that's still trying to maintain homeostasis, and those symptoms of that illness are a reflection of that. The allopathic model says the symptoms of that illness reflect the disease. You remove the symptoms, you remove the disease. That's why when you have a headache, you take aspirin. That's why when you have inflammation, you take an anti-inflammatory. You have depression, you take antidepressant. Anti-medicine, because why? You want to stop that particular thing from happening. That's allopathic, right? That's what we all know. We all have done this, and it's okay. Unless you think it's doing something good for you in the long run. It's not. Because as long as you're stopping the thing that's happening, you're not helping the organism maintain homeostasis. In fact, you're getting in its way. Because that symptom is, in fact, what the body is best able to do at that moment in time. Every living organism is constantly trying to do the best it can at that point in time. If that wasn't true, we couldn't have evolved to be sitting here talking about it. Let's imagine an organism 10 million years ago decided, well, I don't think I'm going to try to do the best thing. I don't think I'm going to try to be healthy anymore. I'm not going to try to do the healthiest thing I can. I'm just going to do the unhealthiest thing I can. I'm talking about it on a physiological level. And what's going to happen to that organism? It's going to die. It's not going to have any progeny, and it's not going to evolve. And that's the end of it. So every organism that evolved, human beings included, had to maintain homeostasis the best it could at every moment, because as soon as you don't maintain homeostasis, you're dead, right? So how come, this is a rhetorical question, how come when a person is ill, those symptoms aren't part of that homeostatic process? How could that be? Is it even logical to think that there isn't some reason that the organism is producing that? Otherwise, where does it come from? So the model, conventional model says something broke, kind of like the carburetor on the car. So the carburetor broke, so let's fix the carburetor. But are living organisms machines like that? Are they cars? Are they automobiles? Can you take that carburetor out and clean it and, recycle it, go to the junkyard, get a new one, put it back in, or whatever? Can you do that with a living organism? At what point can you take the hand off and send it off to get it fixed? No point. A living organism is a whole entity. You take something off, it's gone forever. You can't put it back. Of course, we do have very complex techniques for doing organ transplants and stuff like that. So you might argue, well, but there's that. But if you have any idea how many drugs it takes to keep that organism from, that homeostatic mechanism from rejecting this foreign tissue, you realize this is an extraordinary intervention and has very little to do with maintaining homeostasis. So what we're dealing with when we're talking about natural medicine is a system that sees every living organism is constantly trying to heal itself, and our job is to help it do a better job of that. The symptoms reflect that ongoing effort, so we need to respect what's going on. We might use something allopathic to help things in the short term, but in the long term, if we're going to help that person recover their health, not just feel better, but recover their health, we have to deal with the homeostatic mechanism, because that's what's going to heal itself. All living organisms that heal, that recover their health, do it because they do it themselves. We cannot. There's no medicine, no natural medicine, no drug, no surgery. Nothing can make something that's alive heal itself. All it can do is remove obstacles, support things along the way, maybe make you feel better while it's happening. But if you get well from something, it's because you did it itself. This is a bottom line rule, and medicine, even conventional medicine would admit this. Yes?
Antibiotics. When you're sick, you take antibiotics better.
Well, the beauty of antibiotics is that they don't interfere so directly with the homeostatic process. If you have a fever with an infection, let's say you have sinusitis. So you have a fever, you have a bacterial infection, so antibiotics could help that, as opposed to a cold, which is viral, and antibiotics won't help, despite the fact that most people still take antibiotics for that. But let's say you have a bacterial infection. You take the antibiotic, or you could take the antibiotic. So what's happening when you have this infection? You might have a fever, you might have nasal congestion, runny nose, thick, gunky mucus. Well, what is that thick, gunky mucus? That's a combination of bacteria and white blood cells. Where do those white blood cells come from? They came from our body to fight the infection. So that is actually the body's response to the bacterial infection. So what happens if you have a fever, we'll use that example still, the fever is also part of the body's efforts to fight the infection. The body increases its metabolism. The elevated temperature makes the bacteria less able to get what they need to survive. There's a whole list of things, if you go to a physiology book, you'll find that are beneficial from fevers. Until very recently, you were always told if you had a fever, take some aspirin and call me in the morning. Why would you want to do that? Because it makes you feel better. But what are you doing if physiologically we know fever is a beneficial response to a bacterial infection? You're actually getting in the way of that homeostatic process. Now, you have a bacterial infection, you have a fever, you take an antibiotic. Does that affect the fever? Probably won't, though there's sometimes things like that will, even though we don't know why. So in this case, you could do both. You could do the allopathic orientation, which is to attack the symptom with the antibiotic, but not suppress the fever, and take lots of fluids and do other things to support your immune system and have a nice outcome. Well, on the other hand, if you were to suppress the fever, then you would be actually getting in the way of your body's efforts to heal itself and probably lengthen the time it takes to recover. It's a little harder to see that when you use an antibiotic with a bacterial infection, but with a viral infection, if you suppress the fever, in my experience, you will always lengthen the time you're ill. Or the same thing with decongestants, and antihistamines and so forth. You take those when you're sick with a cold, you're usually going to be sick longer than if you don't take them. You'll feel better for a while, but you'll be sick instead of being sick 5 to 7 days, you'll be 6, 7 to 10 days. That may not be a big sacrifice if it means you're able to take care of your family or something, but a lot of people just use that so they can go to work, which is a very bad reason to take an antibiotic. Stay home, be sick, that would be a better solution. Okay, I think I lost my train of thought there for a second. So this idea where symptoms are and the idea of how we look at them are very fundamental to these different philosophical views. If you can understand these two philosophical views, then you can assess any healthcare option that you're considering and decide whether this is going to lead to further health or just control symptoms. Now, most of what conventional medicine does, most of what we do ourselves, even most of what alternative medicine does, is palliation. Palliation is a wonderful term to know. Not everybody in the lay public knows. You're all healthcare students, so hopefully you know. But I'll tell you just in case you don't. Palliation is when you do something to control a symptom. So aspirin for a headache is palliation. Aspirin for a fever is palliation. Almost everything that conventional medicine does is palliation. Palliation is a wonderful thing. You feel better. Life gets a little easier. Your symptoms are better. But what does it do in terms of recovering your health? If it's an acute illness, palliation, like the example of the cold, just means you might be sicker a little longer because you're feeling better, but that's okay, a sacrifice you might be able to make. But what if you have a chronic health problem? Then what does palliation lead to? So let's say you have arthritis, and you want to take an anti-inflammatory aspirin, for example, or Tylenol, or whatever you might be using, some more complicated drug. So if you have a chronic health problem, what does palliation do? What is the outcome of palliating arthritis? Do you know anyone who's ever recovered from arthritis by palliating it, which is basically by taking all the things that you normally take for arthritis? Of course you don't know anyone who's done that.
It gets worse, doesn't it?
Over time it gets worse. Degeneration continues. Often the medications themselves contribute to some of the degeneration. The non-steroidal anti-inflammatory agents, for example, lead to degeneration of the joint, even though you might have no pain. You're feeling good, but the joint's degenerating all along, even though your symptoms aren't there. So palliation is a great thing if you realize that's what you're choosing to do. But when you do palliation thinking that that's your best treatment, basically what you're doing is agreeing with the definition of chronic disease, which is it's incurable. Conventional medicine, chronic disease is incurable. That's how it's defined. If it's called a chronic disease, it means it's incurable. Let's name some diseases and we can say, is that chronic or is that some other kind of disease? Just toss a few out here.
Muscular dystrophy.
There's a chronic disease. Others?
Diabetes.
Chronic disease. This is the part where you're supposed to stay awake. So everybody you know who has to go to their doctor, most people you know goes to their doctor, go for chronic diseases, especially after they hit beginning to get into middle age, especially then. Acute illness means, by definition, it's self-limiting. You either recover or you die. Acute illness. Pneumonia you might die from, but most things you recover from. There is a sort of a middle category where if you suppress an acute illness long enough, it can go into a subacute and eventually become a chronic illness. So that's a nice thing. But for the most part, we define disease as acute or chronic. In conventional medicine, chronic disease means it's not curable. It means all we can do is manage it. Now, there are exceptions, of course. If you have fibroids, uterine fibroids, we can cut the fibroids out. That could be called a cure. Or if you're, or just take out the uterus altogether, that works pretty good. There's people do that all the time, and it works out okay for them. So, we're not like passing total judgment on that. But the question becomes, how did that person get fibroids in the first place? How does removing their uterus deal with the fact that this came from somewhere? Right? Or was it sort of just you were walking along and one day it fell out of the tree on your head? No, most chronic disease comes because a living organism is born with certain susceptibilities. They lose their health over their lifetime, and those susceptibilities begin to get expressed. So each of us were born with the seeds of our own destruction already there. So what do we do about it? So we start feeling, well, first off, we eat bad, a terrible lifestyle, drink, or whatever else we might do, or we grow up in a stressful home, abuse. There's all kinds of things, just pollution we have no control over, things we have control over, things we have no control over. But they wear us down. So you're born up here on the top of the hill. That's your optimal state of health that you can maintain. It may not be that high for some people. Some people are born pretty ill. But other people, it might be really good. And you go through life, little insults after little insult after little insult, and some big ones come along as well. And eventually you're moving down that hill. Your health is less and less and less. And somewhere along the line, you meet up with that susceptibility that you were born with. At that point, you get sick. Now, the options are to relieve the symptoms, palliate, or do something to restore health so that you start moving back up that hill or mountain if you happen to be lucky enough to be born with good health. And that's what we're talking about with natural medicine, is how to get you to go back up that hill instead of just make the symptoms go away while you continue to slip down. And that's why chronic disease is incurable in conventional medicine, because all we're doing is addressing the symptoms, trying to treat the disease, not dealing with the person who has the disease. So we come to another concept, holism, treating the whole person. A living organism, as I said earlier, you can't divide it up. It's all one thing. So if that organism is ill with something, arthritis, it's not just in the joints, the whole organism is ill. The whole organism is attempting to maintain balance, attempting to maintain homeostasis, attempting to be as healthy as it can be. And if it has arthritis, that's the healthiest thing it can do. If it could do something healthier, it would. So our jobs as natural medicine type practitioners is to help it do something better, help it get better, the organism get better so that it no longer needs to express the arthritis. As it does that, you move back up that hill, and the person's health begins to get better. Lo and behold, the arthritis goes away. Not palliated, but goes away. There's no more inflammation in the joint, and so on. That's what natural medicine is about. And that's not the same as alternative medicine. Much of all natural medicine is alternative, but some of alternative medicine is not natural. For example, chelation therapy. How many people have heard of chelation therapy here? Anybody? Not too, a few. Okay. Chelation therapy is the IV interjection of EDTA, a chemical, into the vein to chelate or take out calcium and other minerals. They use it to take out heavy metals like lead poisoning and things like that. But they also use it to treat vascular disease as an alternative to coronary bypass surgery. And so they believe, and evidence would suggest that it in fact does relieve this to some extent. So these people don't need to have, they do chelation, and then they end up not needing to have coronary bypass surgery. It's a controversial thing. It's not accepted by conventional cardiologists. But as you can see, it's an alternative because it's not accepted. But what's natural about sticking a chemical into your vein to treat the disease? Nothing natural about it at all. So that is alternative but not natural. That's why I make the distinction. So as someone, myself, who practices a form of natural medicine, what I want to do with every patient I see is understand them as a whole person and prescribe something that will help their organism do what it's already trying to do to heal itself. That's my goal. With an acute illness, we might do the common things like echinacea, golden seal, vitamin C, or whatever that helps people fight an acute illness, an infection like a cold or something. So the organism is trying to fight this off, so we do have a little extra help, maybe more water. And for example, one of the things I might use is fever therapy, where I actually give an artificial fever to the patient. Hot bath, raise their body temperature up. This is the problem with most adults is we're not healthy enough to have a fever anymore. Little kids, on the other hand, they're healthy enough to have a fever, so they get over it. We, on the other hand, it drags on and we feel bad and whatever. To use an illustration there, either ourselves or someone we know has had chronic ear infections. It's a very common problem with kids. Means they get an ear infection starting in the fall, and there's another one and another one antibiotic after another, right? We all know this story. Somebody we know does this, or we've done it ourselves. Then there's other kids who get 1 or 2 ear infections in their life, and those kids, what do? What's different? They have a fever. The ones that have the chronic infections almost never have a fever because their body's not strong enough to mount that defense, or it was suppressed, so they couldn't mount that defense. So they don't get over it. Whereas the kid who has the fever, they're screaming and hollering, their eardrum may burst, but then they're over and they're fine. They recover in most of the cases. Even with the burst eardrum, they usually are fine. There's no ongoing damage. Occasionally you see that happen where there's hearing loss from that, but it's rare actually. Most people wouldn't know that, but it is. So we have an example where fever here makes the difference. So I might have people who come to see me with an infection, or they call me on the phone, and I say, do the fever therapy. Every patient, we hand out these handouts, which you can find on our website, www.heartlandnaturopathic.com. Free advice. I don't think it's on the handout because I think the handout's old enough I don't have that. But it's just heartlandnaturopathic.com. Naturopathic, that might not even be on there. My goodness, that is old. I better update that. So on that website, you'll find the handout how to do a fever therapy, which is, if you don't have a fever, you give yourself a hot bath and take a thermometer in with you, and you raise your temperature up, and you keep it up for a while. It's amazing how well that works to quicken the recovery from an infection.
So just doing hot baths daily might help overall for your health?
No. If you don't have an acute illness, a hot bath is good to be clean with or relax your muscles or whatever. There's other reasons, but it isn't going to, I don't think it in its nature is going to induce health. In fact, the old hydrotherapy people from last century, which naturopathy, my degree, I didn't even talk about my degree, did I? My degree is Doctor of Naturopathic Medicine. That profession is like about 100 and some years old, and they came out of the hydrotherapy tradition. And cold water is the secret in hydrotherapy for getting your health. Alternating hot and cold, or actual bathing in cold water. When you take your hot shower, you should finish with cold. These are the old, I don't do it because I hate cold water, but you should do it. Everybody would be healthier if we did it that way. But the old techniques, they would cure all kinds of things. Tuberculosis, arthritis, chronic diseases with hot and cold baths and douches, they call them, spray. People would stand in these, the photographs from these old sanitariums are amazing. Big tiled room, and there's a person in there, and they're spraying them with cold water. So, whoa. One of the techniques they would use was the cold sheet wrap, which is a variation of that. It's on the website, is the cold sock treatment. Well, cold sock treatment is a way of dealing with congestion at night instead of taking a decongestant because you can't sleep, you're all stuffed up. You do this, you put cotton socks on that are wet on warm feet. The instructions are on there. And then you put wool socks over that, and you go to bed, and lo and behold, you can breathe through your nose. It's amazing. It's like magic. It's a great technique for massage therapists, these kinds of hydrotherapy, and I think that's really part of your practice too, or part of your scope of practice. So the cold sheet wrap is the same thing done on the whole body. So they wrap them up in wet sheets, cotton sheets that are cold and wet, and they wrap them up in lots of wool blankets, and they'll stay in there until they dry the blankets out. And which doesn't take that long. It's actually the body really creates a response. And this response is stimulating the body's actual healing mechanisms. And people will, they'll unwrap them, these old stories you read about. I've never done this because these techniques are rarely used today, but there are a few places you can still find them. And the sheets will sometimes be brown from the stuff that they sweated out. These are sick people, of course. And very powerful techniques. If we had sanitariums like this around here still, and people still use them, we'd have a lot less chronic disease. They're amazing. In Europe, they're still very popular, but not here. and the insurance covers them and everything. It's an amazing place as far as health goes. Okay, back to time. So my main modality is homeopathy. You already heard, Dr. Sorensen was here talking about acupuncture, I believe. So she talked to you about what naturopathy was. I don't have to really go into the education, 4 years, graduate level, and all that stuff, which I might add is different than buying one online. Very big difference. Buying your doctor degree. Yes, you too can be a doctor. All you need is about $5,000 or $6,000, and they'll be happy to give you a piece of paper. My own suggestion is go down to Kinko's, make your own. You'll get as good an education. If you encounter people who have these degrees or who are considering getting one of these degrees, I would caution you that the information these folks have or think they have is very flawed. There's lots of huge gaps and a lot of myths. So if you encounter, every magazine has ads for these places where you too can become a doctor, doctor of natural medicine. The equivalent education is maybe a semester of college if you do the whole program, and you get a doctor for that. So obviously they're not, it's not the equivalent of going to 4 years of medical school with several years of clinical training. So that's my little wrap on the other guys. But they're around. There's actually somebody in Council Bluffs who advertised themselves as a naturopath who has that kind of degree. She also has a PhD that she got the same way, so she's a double doctor. Must be pretty smart. Okay, homeopathy is my specialty. Dr. Sorensen is a naturopathic doctor who specializes in acupuncture. I specialize in homeopathy. Naturopathic medicine includes all kinds of natural therapies, the diagnostics, physiology, pathology, all that we learn, just like medical doctors do. And some of us will specialize in certain modalities. Dr. Sorensen specializes in acupuncture, so she has a master's in acupuncture on top of her doctorate degree. I specialized in homeopathy, so I'm board certified as a homeopath, and I continue to go to extensive seminars year after year to perfect my skills. The reason that I chose to go into my specialty, and I think the reason she chose to go into hers, is because both systems are very deep acting and they're very much involved with working with this mechanism, this healing mechanism that every living organism is constantly engaged in when it's ill. Homeopathy is a very particular way of doing that. Each remedy is made in a very particular fashion. It's not the same as herbs or nutrition or any of that stuff. Homeopathic medicines are manufactured in a very specific manner. Natural substances, they're diluted many times and agitated while they're diluting them, so they're mechanically agitated. We call it succussion, which adds mechanical energy, and each remedy is tested on human beings to find out what it does, and then that information is used to match that up to the person. So each person is one whole person, so each person gets one remedy. And my task as a homeopath is to find which remedy it is that you need as an ill person. So that's the overview. Specifically, homeopathy has been around about 200 years. It was discovered by a medical doctor in Germany, a physician. At that time, this was sort of the Renaissance, and physicians typically were also chemists and pharmacists and very well educated and so forth. And he couldn't stand medicine at the time because it wasn't helping anyone that he could see, and he decided to start translating medical texts, because like all these Renaissance people, he spoke 6 or 7 languages, but which is really common in Europe, actually. Not here. So they all have to learn English to talk to us. So he was translating a text from an English botanist or herbalist or doctor who used botanical medicines. And this doctor was talking about how cinchona bark, which is what quinine is made from, cures malaria. And as you may know, quinine is an effective herbal treatment for, well, it comes from herb, but it's still used in conventional medicine for malaria. Quinine is a common medicine for that. So quinine comes from cinchona bark, but back then they were using the actual bark, cinchona bark for treating malaria, and it was successful, fairly successful. So he was saying the reason it was successful, this author was because it was a bitter. Now that's just a classification of herbs. You put it in your mouth and it's like that. And it's very bitter. And the founder of homeopathy, Samuel Hahnemann, said, oh, this is ridiculous. I know lots of bitters that have no effect whatsoever on malaria. So he did something which nobody quite knows why or how, but he started taking the cinchona bark himself to see what would happen. And after 3 or 6 weeks, whatever it was, he just started developing intermittent fevers. Well, those of you who know, malaria expresses itself through intermittent fevers, fevers that come and go, right? With me so far? So by taking cinchona bark, he had a toxic reaction to it, which produced symptoms similar to malaria. So his conclusion was, accurately, like cures like. Cinchona bark cures malaria because it can cause the symptoms of malaria. Now, let's go back to what I was talking about earlier. You're probably thinking, I don't know why he was talking about that, but here's the reason. Since we see the living organism as attempting to heal itself at all times and the symptoms it's producing as the body's reaction to the disease, if we give a substance to someone who already has those reactions occurring, in this case malaria, they're intermittent fevers, and we give them something that can cause intermittent fevers, we are actually pushing that living organism in the direction it's already trying to go to heal itself. It's trying to heal itself by producing the fevers. It's not being successful. That's why it's a chronic problem and not an acute. It doesn't have enough vitality to finish the healing process, but it's attempting, and it will continue to attempt up to the point of death. So we give it something that matches exactly what it's already trying to do, and that's just enough of a nudge for it to heal itself. And so cinchona bark cures malaria. Not palliates, but cures. And that's every remedy that we use has been tested on human beings until they produce symptoms in those human beings, and that was all recorded. In the early days, it was the doctors doing it on themselves. Now we use homeopathic students or naturopathic students. You guys could do approving too. It's called approving. So we pick a natural substance, and you all take it until you get sick. And then we write that all down, and we will have a new remedy. I'm sure. You just sign up right after the lecture. But if you're a homeopathic student, you're kind of motivated. And the beauty thing is when you stop taking it, just like Hahnemann discovered, you stop taking this substance, the symptoms go away. Because it's just the body trying to throw off the effect of this substance. That's the toxic reaction. So Hahnemann and his colleagues tested many remedies, many natural substances at that time, to see what they in fact could cure in the proving, what symptoms came up in the proving. They also used toxic substances like mercury and so forth, which wouldn't be safe to use, and they would use the symptoms of the poisonings and stuff like that to tell what the remedy would cure. A good example of that would be belladonna, which is a toxic herb. If you take enough of it, you start hallucinating, and eventually it would kill you. It's toxic enough for that. It also causes a lot of flushing, and people get very hot and feverish, and throbbing, pounding headaches when they take it. And that would be an effect of taking the belladonna if you just started taking the herb or the tincture. And so what do you suppose? That's what we use it for, right? So if someone comes in with pounding headache and they're flushed and it's pound, pound, pound like that, and they're all flushed and they're hot and they're really uncomfortable, if they get sick enough, maybe they have a fever, they might go into a fever, let's say, for whatever reason. These are all things that we might see with someone who needed belladonna. They might hallucinate. These would all be the symptoms we'd use belladonna for. What also works out, belladonna is pretty good for strep throat. You have the throbbing pains often, red, intense fevers. So it's they sometimes call it specific for strep throat. It's not really, but it's an example of a remedy that might be good for strep throat. So each of these remedies are like that. There's a collection of symptoms that fit a whole person. If you read about belladonna, you'll find mental, emotional symptoms as well as physical symptoms. And you match those symptoms up to the patient who's presented in front of you, who has those symptoms. If it's the right one, you give it. It helps the person, they get better. The problem with homeopathy, in terms of its, first off, you have to find the right remedy, otherwise nothing happens. These remedies are very dilute, and that's where we kind of got criticized. Homeopathic remedies are diluted so many times that our critics would say there's nothing in them at all. And maybe that's true, but they still work. We have lots of studies, I quoted some in there, showing that they still work. But Hahnemann wasn't satisfied with what was happening when he was doing the work, and that's what led to this dilution process. Because if you give the belladonna to somebody with strep throat, sometimes they'd get so sick they might actually get close to death, or maybe even did die. Back then, it was very common to die if you went to a doctor. It was the last thing you wanted to do back then. Their medicine was so primitive. They'd bleed you or put leeches on you or something like that. So it wasn't that uncommon for people to die. But he wasn't very happy with his patients dying. So he didn't like the fact that when he gave some of these remedies, if you have strep throat and you take belladonna in the tincture form, and your symptoms flare up because you're giving something that causes the same thing, you may have a healing response that resolves the whole thing, but before the healing response, you got this flare-up of symptoms, right? That's not such a great deal. So he started diluting the remedy, making it less strong. And what he imagined would happen was, of course, he had less of a reaction, but also less of a healing response. So eventually, he said, this isn't working because we get it so dilute it doesn't do anything anymore. So he did something unique, which was, again, he did this succussion thing, where he diluted it and shook the remedy up vigorously between each dilution. Serial dilution, so you do 1 drop of the belladonna tincture into 9 drops of water and alcohol, and you shake it vigorously. They take a vial and they pound it into their hands. That's their old way of doing it. 100 times, bang, 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 like that. And that would be 1x. And then they would take a drop of that and put it into the next 9 drops of alcohol and water, do the same thing again, and that would be 2x. So it's serial dilution, like that. So he might go all the way up to 12x, 30x. That's quite a few dilutions. At some point, you dilute it so much, there's nothing left of the original substance. And that's where we sort of lost the conventional model. And they often make jokes about homeopathy as, or if you're a medical student, sometimes you say, oh, how much should you give this patient for this condition? And you say, 20 milligrams. And he says, oh, you fool, that's a homeopathic dose. So they make jokes about it, that if you're giving too little medicine, it's homeopathic. It's kind of a little thing that many medical students can tell you about. But of course, our remedies are actually far more dilute than 20 milligrams. So what's going on there? How can that be? What he found was that when he did this, that the reaction went down, as you'd expect, because it's being diluted, but the healing response actually increased. So people get better, more faster, and more permanently with the lower dilutions, as long as they're succussed. Unfortunately, we can't explain why. We have a lot of research, which I've tried to include some of that in there. There's a number of physics things that are going on now that are beginning to reveal how this works, but I'm not going to get into all that with you today. But we do have clinical studies that show it works. We have animal studies that show it works, cell culture studies that show it works, and then, of course, my own personal experience and 200 years of homeopathic physicians' experience that says it works. It doesn't always work. There are limits to what we can do with this. End-stage pathology is very difficult to treat. If you have arthritis, use that example again, and your joints are degenerated, giving you the right remedy might stop the inflammation, stop the progression, but it's not going to grow back a new joint, right? So in that case, surgical intervention, joint replacement might be essential to someone. I've had patients like that. We cure the arthritis, but their knees are still shot. So then they get knee replacements. But they don't have any more arthritis, and their progress of the disease stops. So homeopathy's forte is basically chronic disease. Though it's very good at acute disease as well, we don't use it nearly as much here because acute disease is fairly well managed by conventional medicine. But if you have a viral infection or something, you're still better off with homeopathy at this point. So I'm running out of time. Normally I just keep talking, but the film doesn't let me to do that.
You have 9 minutes.
9 minutes?
Yeah.
So let's answer a few questions now. Okay.
You have a lot of letters here after your name. Could you tell me what those are?
In Nebraska, I'm licensed as a mental health practitioner and it's called a medical nutrition therapist. Those are my licenses. I'm required by law to put them behind my name. The ND is my degree, and the other 2 are my licenses. And there's a DHAMP on that one.
Yeah.
That's my board certification as a homeopath. But you can call me Randall. Yes.
Possibly, if we could come to see you, is it a long way to get into your office, or do we need to make an appointment? Or?
Well, yeah, you have to make an appointment, of course. It's a month or a little bit more to get in, to get a new patient visit. Most of what I work with is chronic disease. In Nebraska, I'm not licensed as a physician, though we have licensure as close as Kansas now. And California just last year passed a new law, so we're moving along. It's only 13 states, though. In a state where we're not licensed, we generally don't practice the full scope. In a state where we're licensed, we practice like a general practitioner, diagnosis, physical exams, lab tests, that whole shebang, and often quite a bit of insurance coverage. Here, since I just work with chronic disease, I'm not licensed as a physician, I don't do much diagnostics. What I do is I work with people who have been diagnosed already. They come to me, they say they have arthritis, they have Crohn's disease, they have migraines, they have allergies, whatever it is, and then I work with them to recover from that. But I don't do the diagnostic, the primary care stuff myself. Yeah, a little bit. But homeopathy is, in my experience, one of the best ways of dealing with mental emotional illnesses because we don't make a distinction. A person's sick. They may have, everybody who's sick has something going on mentally, emotionally, and they usually have something going on physically. And so one person is emphasized here, another person is emphasized there. But I'm treating the whole person, so I don't make a big distinction. They may come in, their chief complaint may be depression or anxiety, but I'm going to treat them the same way as if the person comes in with a chief complaint of arthritis. They still need to get the remedy that fits them as a whole person. So we don't divide it up. It's true holism. Other questions? Yes?
How long does it take you to come up with a remedy?
My initial visit is 2.5 to 3 hours. Most of the time I give a remedy at the end of the visit. Sometimes I study it a little bit for a half hour, an hour, sometimes several hours. If I've been working with someone for a long time and I've been having trouble, I'm sure I've spent 8 hours studying a case. That fortunately is not the norm. Most of the time, over half the time I give the right remedy the first time. Sometimes I have to, study the case or see them several times. Sometimes they do better for a while, maybe a year, and then it sort of kind of doesn't seem to work anymore. I have to go to a new remedy. And of course, we're dealing with problems that they've often had for 20 or 30 years or more. In other cases, I have total failures where I haven't done a thing for. They're a small percentage, I'm happy to say, and there's less every year. I'm really happy to say. Other questions? Yes?
Do you use herbs only? Or?
Herbs are part of my naturopathic orientation, and it's not homeopathy. Homeopathy has nothing to do with herbs, though many herbs have been turned into homeopathic remedies, but they're not used as an herbalist would use them or as I would use them as a naturopathic doctor. So I might use them with the acute things I talked about, or I might give them as an adjunctive therapy to the homeopathy, but I don't see them as curative in many cases. In most cases, I see them as palliative, or if it's acute illness, perhaps curative there.
So what kind of stuff do you use?
Well, I use homeopathic remedies, of course, and they are made from herbs and minerals and animal substances and stuff like that. So they're all made from natural things. They're turned into homeopathic remedies, and then they all look identical. You all take them the same way. The only difference is you have to just match up the right one to the right person.
Like when somebody would volunteer to take something until they get sick, or
The proving?
yeah, I was curious. That's kind of
guinea
fascinating to me, actually.
And there's a question in there?
I'm wondering, how long does it take for them to get sick? Is it like
Well,
immediate, or
there's
does
a
it-
number of ways it's done. The most common way, they start out with a higher potency, so they're not using the dose of the mineral in the material form. They're already made it into a homeopathic remedy. And one of the things they do is, so that way they're not being poisoned. And that will produce symptoms in a few weeks or a month, sometimes within a few days, if it was sensitive provers. It's a complicated process. They take the case of the patient before, or the prover before they give the medicine, and then they take it after and they see what's changed. There are a lot of different ways they do it, but that's the general way. And they also use things like dreams and things that occur after taking the remedy. Yeah, actual dreams give us information, and then the physical things that happen. And it's an interesting process. I've never done one. I have to admit, that's probably, I should be ashamed of myself, but true confessions. I've never done improving, but I'd be happy to do one on you guys.
So a general ailment or whatever, of doing that would be what, fever, diarrhea?
Yeah.
cold, or
Oh, yeah. Something
those
like
type
that.
things?
Mm-hmm.
Nothing like
They might
numb
get.
legs or anything
What's
like
that?
that? Nothing like numb limbs or?
No, they could have numb limbs.
Yeah.
You could have
Anything.
anything, but what you won't see is the way they do it. They structure it so you don't see physical pathology that leads to anything permanent. You know, it's usually just sensations and functional things, and then as soon as you stop it, as soon as you develop symptoms, you stop taking it, and then you know. So yeah, it's safe to do for the most part.
So recoveries. Basically.
It's like 98% of the people recover completely from the proving.
Quickly.
Yes, quickly and completely. But there are those few people who shouldn't do provings because they're too sensitive, and they end up with symptoms that they have to be treated for later. That's the
They would
downside.
get reduced rates probably.
Yes, and they get very reduced rates in those cases. That's one of the reasons I've never done them, is because I'm not in a situation. I'm not at a school and so forth and so on like that.
How accurate, like at Wild Oats, when you go to Wild Oats and they have all their homeopathic medicines and they have a little booklet and you can look up your symptom and it tells you what to take? How
There's
accurate
two
is
kinds of
that?
things you'll find in a store like this. One will be single remedies, which you look up, and they're usually best to be used with acute illnesses. You look up the same way I would look it up, except that I have more information. So with belladonna, it would be like the indications I spoke of. But then they also will have combination remedies, where it'll say flu on the bottle. So you buy a combination remedy that says flu. And what it has in there will be 8 or 9 remedies that are common for different flu presentations. So they'll stick them all in the same bottle and hope that one of them is the one you need. And if it works, it's fine. And it's acute illness, so it doesn't really matter. But if it's a chronic illness, I don't recommend using combination remedies, because if you take them very long, you can do what? What happens if you take a remedy long enough? You do a proving, exactly. So what happens if you take 10 remedies for a year? You'll likely develop proving symptoms. And people who are doing this don't realize they're doing it. They just think they have a new problem. So then the worst case scenario, they go back to the store and they find now I'm getting headaches, so they find the one that says headaches, and they start taking that one. Now they're taking 20 remedies. And they take that for another year, and it's just, these people we've, in the literature and teachers of mine have seen cases like this where cases are so messed up because of taking multiple remedies for long periods of time that they never figure them out. So it's okay with acute illnesses. I do not discourage anyone from using combination remedies with acute illnesses, because it's self-limiting. You don't take it very long, it's over. But chronic illnesses, you shouldn't use them very long. If you have an allergy thing going, in the spring, you take it for a few weeks, that's fine, don't worry about it. But if you're going to take it for a year, then now you're into risky situations.